you.
Thank you so much, Marissa. Hands up, who here talks to themselves?
Me?
No, be honest, be honest. I'm one of those people. Who here talks to themselves?
Every day.
What kind of stuff do you say? This has got to do with
Just
what you're
we all
talking
do it
about,
already,
Marissa.
Just do it better.
Who's ever watched Cristiano Ronaldo do a free kick? He talks out loud to himself.
He does.
He says, it's normal for you to score. You can get it over the barrier.
Thank you.
He actually says it out loud. Watch him do it. It's absolutely incredible. So what Marissa's talking about is for real. Talk to yourself out loud. Thank you so much, Marissa. And so now, next, ladies and gentlemen, we are going to be exploring...
15 minutes? I have no idea because I couldn't see the... was there a timer?
Guys, microphone. We're going to be exploring the partnerships and investments that are driving innovation in the health and wellness sector. So please do join me in welcoming to the stage Nasser Massoud, founder and managing director of Concept Realisation Management Consultancy. Dr. Ghida Harfouche, the partner at TVM Capital Healthcare. Shirin, Bamboat, the head of HR strategic projects at VFS Global. Dr. Chichi Menakaya, the CEO of Annomo Health, and your moderator, Jayda Shoukry, content producer at Forbes Middle East. Ladies and gentlemen, please put your hands together for your speakers.
Hello, hello. Is everybody doing well? Are we feeling the effects of the Wellness Summit? I'd like to invite all the amazing speakers on stage. Dr. Chichi Menakaya, please join us. Mr. Nasser Massoud, Shirin Bamboat, Dr. Ghida Harfouche. It's a pleasure to have you with us. Okay, now we're obviously here to talk about how amplifying these investments can help with health and wellness. And I'll leave you with a little fact. Over the last decades, we've actually managed to gain 6 years in our lifespans. So now we have 73 years as the average lifespan. This is amazing, and this is all made possible by all the amazing work, research, and investment that goes into this sector. So let's start off with Mr. Massoud. In your experience, what are some of the key trends that we're seeing right now in terms of global investments in health and wellness?
So, good afternoon, everyone. I hope you've been enjoying the day so far. So, I think the first area that we've been seeing in global trends is digital healthcare. And the digitization has really taken this forward, whether it's in telemedicine, artificial intelligence, or even simple things that we all experience, such as wearables. Preventative and personalized care has become a very big thing now, and we're seeing more and more of that and solutions coming up for patients to handle those aspects. Mental health has become a big agenda item, particularly I think during the pandemic, this became more and more prevalent. And I'll mention also chronic disease and the whole thing of aging and that type of care.
Okay, now let's get into business. Dr. Ghida, what are the primary challenges that are facing investors right now, and how can we mitigate and assess these risks before they happen?
Thank you, Jayda.
You need...
Okay, sorry. Thank you, Jayda. I mean, definitely there is immense investment opportunities in the health and wellness sector, but it is complex and rapidly evolving. And as Nasser just mentioned, there are a lot of areas that are interesting. But one of the first challenges that I can think of, especially when we talk about wellness within a wellness conference, is really the fragmentation of the market and the lack of standardization. So currently, I mean, the term wellness is very broad. It encompasses everything from fitness and nutrition to mental health to also medical grade services. A clinic that offers vitamin infusion and a longevity center that focuses on, let's say, genetics, diagnostics. They are all under the umbrella of wellness. And this is one of the challenges that actually we can face as investors, but also as consumers. I mean, consumers get lost. The businesses face challenges in branding. And as investors, this complicates benchmarking performance, measuring ROIs, finding the right investment opportunities that are scalable. So one of the things that we focus on, for example, at TVM Capital Healthcare Partners, we look at opportunities that actually transform healthcare from reactive sick care to exactly what you just mentioned, preventative, proactive model, with the objective of democratizing access to longevity and wellness innovations. Just quickly, in 2 minutes, less than 2 minutes, obviously. Quickly, we've invested recently in a company that called Human Longevity Inc. That mixes AI with genomic data, with medical data, with your wellness performance, and they correlate genotype with phenotype, and actually they provide patients with personalized recommendation. And these are the kind of opportunities that integrate everything, wellness and medical grade services are one of the attractive ones, and these are the opportunities that we look at to mitigate any risk that we face. And of course, you integrate into that telemedicine, you integrate into that AI, wearables, just to create this cross-border patient confidence and this continuity of care, I believe.
Perfect. Now, if we go to the other side of the spectrum, if we talk about what really attracts global investment, I know you've had some experience with this. What do you think the role of established firms like Annomo play in capturing investor interest?
I think for us, right, we've been in operation for 12 years. One thing that we really noticed that attracts investors is actually reliability and the fact that you have a track record that you're actually delivering a scalable business. So I'll give you an example. When we started out, we're in London. Now we're all over, over 10 countries, and we've actually seen our business scale up. So when an investor comes to you, they're looking at your numbers, right? What are your partners? Are you collaborating with the right people? Do you have the expert care you say you're delivering? And more importantly, what is actually what your profit is at the end? If you're starting up a business, like I have 12 years of experience doing this, if you're starting up a business, you need to look at trends in the world. Like what he says, the figures are simple. Healthcare alone is a global place to invest because people are aging. Like, I'll give you a few numbers. By 2020, 1.4 billion people will be over 60 years. That means people will need geriatric service, they will need chronic disease management, and they will need mental health and preventative medicine. If you're an investor, you want to cash into that, right? McKinsey said in 2021 that 57 billion was invested in just AI alone. So with what you mentioned, with AI coming on, everyone wears an iPhone, an iWatch all over the whole place. You're looking at things like that people want to invest in, and that's what attracts people to what you're giving. And we can think about also government policies. A lot of governments want to invest in healthcare, so they're giving people tax rebates, they're giving innovation grants, which is one thing investors are looking for. So for me as a business, if you want people to know you're serious and you want to attract people, show them who your partners are. Show them that your business is scalable. Show them that you're actually flexible to actually grow. And I think that's what's really worked for us. You're the investors, so I think that's really worked well for us.
That's perfect. Now, I'm glad you mentioned that part of it is also collaborative. It's not a single company working on its own. And for this, I would like to ask Dr. Shirin, how do collaborations with healthcare providers and wellness companies, even tech innovators, play a role in strengthening the health and wellness sector?
Great question then. Hi everyone, good afternoon. Hope everyone's having a great time. I think so collaborating is significant. It's the need of the hour. And I think so everyone's been talking about it. Wellness definitely is at the heart of our business and what we do. It should be a way of life as we are progressing. And when we're looking at collaboration, it's all about connecting the dots together, which is so very important. It shouldn't take a COVID for us to wake up and say what is happening through. But when we're collaborating as global organization, what really plays a key role is it's all about productivity, efficiency. But more than that, it's also getting to exactly recognize where you stand right now. And it's very important that organizations recognize that because it helps them in the journey of wellness and well-being. not just for the individuals, for the self, but for the community altogether. And I think so that significance really plays a key role and crucial to be recognized and identified from a return of investment perspective, but also from the knowledge and the quick share that we all can learn from each other. And time plays a key role. Time is of essence. When you collaborate timely, I think so organizations are more proactive. You know, there's resilience that we build. There's also vulnerability that we look into as well. But definitely better late than never. It's important.
Okay. Now, we keep on hearing these keywords, these super buzzy topics. Mental health, AI. Now, let's start off with mental health. This is a growing focus worldwide. This is something that is critical, and I want to know, how are you addressing this through Annomo?
Thanks, Jayda. So I like figures because I'm a surgeon. I love to see figures. So WHO tells us that there are 1.2 billion people living with mental health. And actually, if someone has a mental health disorder, they live with a disability 1 every 6 years. That's a big number, right? And then people that have severe mental health issues will have mortality rates and their life expectancy cut down by 10 to 20 years. So it's not something that we just talk about and let it go. As a company, we've integrated it into the core of our business. First of all, what we've done, again, collaboration. We've sat down and looked for world experts that are psychiatrists, psychologists that have the track record. They've got the experience. They're doctors. They're really trained and licensed to do this. So for us, we're a member-only company. So what we do for our members is that you get a free 90 minutes consultation with a psychiatrist for every single health assessment or every single membership. Then what we've then done is that because we want to try and get it on time and actually tackle it, and WHO shows that if you actually prevent it, then it actually impacts on physical illnesses, because a lot of your cardiovascular problems, GI problems, all stem down to mental health. Again, what we then do is that we have a robust protocol that we put in place so that people will see a psychologist within 24 hours if they did come out positive, and a psychiatrist between 1 to 4 hours if, for instance, they have like an acute psychiatric pathology. But it doesn't stop there, and I think it's really important to think about how technology has shaped healthcare. Because it's okay to go face-to-face and see people, and as you said, pandemic has taught us so much. So there's virtual consultations and telemedicine, which we have integrated into like pre-operative and post-operative care. That way people have mental health support throughout the whole journey. And then I think 2 years ago, we started something called the Complete Wellness. And what that means is people get an opportunity to speak to their doctors face-to-face via virtual consultation and telemedicine. And that, again, is centered around mental health. And I think more importantly, we're in Forbes. We're talking about wellness. Like, this is so refreshing for everyone's mental health in a way or the other. So I think, like, it's a great opportunity to be here, speaking to everyone here. Mental health is the part of our lives. And that's what we've tried to do to, like, tackle it.
That's amazing. And I think it's a bit funny that in some ways technology has pushed the mental health issues, but at the same time it's helping solve them. So there's a lot of back and forth, and this brings me to the next question of what role does technology play in facilitating wellness?
Oh, I think so. Most important is when you're talking of technology, it's people first. And that is the beauty about getting all the people together, global access at any point of time, even in remote locations. I think so. If I ask anyone over here if we can just leave our mobile phones for a minute, how is that going to be? So technology is everywhere. I think so. What is important is how do we really optimize that for the well-being, which is very crucial as well, and for our people all together, and at the same time the community. And Forbes getting us all over here today is just fantastic, because technology is here to stay. It's a way of life. How do we adapt to it? How do we make it more agile is crucial.
This is also one of the areas where I feel like if we look at a global scale, things and the statistics might be a bit skewed when we start talking about emerging markets more specifically, or we start talking about specific regions, then the picture is entirely different. So, Dr. Harfouche, which emerging markets are showing the most promise? And what factors make these areas and these regions very attractive to investors?
I mean, we're in the Middle East. I have to start with the Middle East, right? It's a very attractive region for the investor in the wellness sector. I mean, if we look over the years, there's a lot of investments that have been spent on healthcare and more recently on wellness. If we look, for example, at the UAE has like set itself as a hub integrating healthcare with wellness. If we look at Saudi, like projects like NEOM, for example, these are examples and these are setting a global benchmark for integrating really or blending luxury with wellness, with top healthcare. And if we integrate on top of all of this technology like AI, telemedicine, I mean, you're creating a very attractive investment opportunity for investors. If we think beyond, I mean, in Southeast Asia, you have regions like, or you have countries like Thailand and Malaysia that actually combine affordable healthcare with always this focus on holistic wellness. Latin America is a region emerging more and more as attracting people who are focusing, for example, on mental health retreats and are interested in nutrition-focused programs in a natural setting. So these are just examples, but definitely, I mean, investments in healthcare goes beyond there.
Okay. Mr. Massoud, now obviously we're talking about markets and trends, and how do you see the future collaborations sort of driving innovation? And more importantly, these partnerships, how are they successful? What is the secret recipe?
Well, collaboration is really the key to innovation. And I think if we don't innovate, we just have no chance to solve the global health issues. We really need to innovate, not just in medicines and technology, but also in the method of delivery. And we've seen some really good interventions of technology to really facilitate access to patients. I was in GITEX Africa a few months ago in Marrakesh. And one of the key things that really emerged from what I saw there was the importance of providing access at a primary healthcare level. And that is now considered to be done through providing technology-enabled solutions where you can have a portable, something like a bag, a box, that you can carry with you and take to the patient. And this can actually be done by a nurse, not necessarily a physician, that can take all the vital signs, and they can then be transmitted by telecom centrally to be able to actually diagnose the patient's situation. So this kind of thing, this kind of innovation is really driving it. But innovation doesn't come by itself. It really needs a disciplined way to go about it. And we're seeing there's a lot of factors that drive this kind of innovation, but I want to just talk about two things. One is the multidisciplinary factors. So you really need to bring different skills to collaborate together to be able to deliver some solution. If you take something that we all experience, like a smartwatch, a smartwatch is not just developed by a technology or a company. It really needs the medical knowledge, it needs the patient experience or the user experience, it needs the medical professional experience, and it needs those. So really bringing together different groups to bring that kind of innovation so that it is useful is important. The other aspect, I would say, is the involvement of the public and private side. Because in a way, most of healthcare is being delivered, let's say, in the developed countries by the public sector side. Yes, we see more private in the emerging markets. But if you're looking for big databases so that you can actually utilize this data and come out with meaningful results and test them and so on, then you need access to that patient body. And that can only happen by collaboration between the public and the private. So we're seeing some very positive outcomes from that type of collaboration between the public and the private.
That's great, and I think it's helping that the upcoming generations are becoming more and more health conscious, like they actually want the products and the services that are being developed. I want to thank you so much for all the valuable information. It has been a pleasure having you with us, and I hope you're all enjoying the Medical Tourism and Wellness Summit.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you. Thank you. Okay. We're going to have a... Okay.